Royce Regional Health Network welcomes you to the Equity Circle podcast.
Hello, today is December 22nd, and today we will be discussing the winter surge. A winter surge has begun. We are facing a triple-demic of COVID-19, flu, and RSV. Young kids and older adults are among the groups that have been severely impacted by respiratory illness this season. COVID-19 cases, hospitalizations, and deaths are all rising significantly nationwide, with nearly half of counties now at a medium or high community level. Hospitalization rates saw the sharpest spike among people 70 and older. Flu activity continues to be very high in 26 states and has resulted in at least 30 pediatric deaths so far this season. RSV cases remain high, but are in decline across all regions. Everyone 6 months and older who is eligible should get their flu shot and Omicron vaccine. No vaccine is 100% effective, but they are a crucial layer of protection against infection and especially against severe illness. The FDA and CDC expanded use of the bivalent COVID-19 boosters, which are designed to provide broad protection against COVID-19, as well as provide protection against two specific variants of COVID-19 to children as young as 6 months. Kids under 6 years who got Moderna's primary series can get Moderna's bivalent booster 2 months after their last shot. Kids under 5 years who started but have not yet completed Pfizer's 3-shot primary series can get Pfizer's bivalent vaccine for their 3rd shot. Kids under 5 who have already completed Pfizer's primary series are not yet eligible for a booster or a 4th shot. It is safe to get a flu shot and COVID-19 vaccine or booster at the same time. It's time to wear high-quality, well-fitted masks in public again. Last week, the CDC director encouraged people to wear high-quality, well-fitting masks to protect against respiratory illness this holiday season. New York City and Los Angeles County have also reissued their indoor masking recommendations. N95 and KN95 masks provide the highest level of protection against respiratory illnesses and can significantly reduce COVID-19 transmission in schools and at the community level. You may be able to find free N95 masks at local pharmacies and community centers. Here are some frequently asked questions that have begun since the winter surge. How severe is the current COVID-19 surge? COVID-19 cases, hospitalizations, and deaths are rising significantly nationwide, with hospitalization rates seeing the sharpest spike among people 70 and older. COVID-19 community levels, a CDC measurement of community transmission, are medium or high in nearly half of U.S. counties. Compared to previous waves, the current surge is relatively mild, though it's important to note that there is a severe underreporting of cases due to at-home testing and at the closure of testing centers across the country. It's yet to be seen whether the recent upticks will turn out to be temporary or indicate the start of a substantial winter surge. How is this winter different from previous pandemic winters? COVID-19 is not the only respiratory illness of concern this winter. Flu and RSV have been filling hospitals, especially children's hospitals, over the past few months. These two non-COVID-19 viruses have reappeared in full strength after 2 years of milder seasons. With COVID-19, flu, and RSV now in circulation at the same time, the U.S. is in the middle of a triple-demic that has severely impacted young kids and older adults. Take extra precautions this winter and stay protected against all 3 viruses. How can I protect myself and my family? The best way to stay protected this winter is to use as many layers of protection as possible. Vaccines and boosters are crucial. Flu shots and bivalent 19 vaccines are available to kids as young as 6 months old. High-quality, well-fitting masks are also key. They can significantly reduce COVID-19 transmission in schools and at the community level. Washing your hands and using ventilation and filtration tools at social gatherings will also decrease your chance of getting infected and limit transmission. Thank you for listening to this community update, and we look forward to talking to you again soon.
The content shared in this episode is for informational purposes only and does not constitute medical advice. Please consult with your healthcare provider about any medical concerns you may have. Reference to any specific product or entity does not constitute an endorsement or recommendation by Choice Regional Health Network. The views and opinions expressed by guests and Choice employees are their own and do not necessarily reflect the official views of the Choice organization. Choice Regional Health Network follows all guidelines set up by the Center for Disease Control and Prevention and the World Health Organization.